Hi, this is Dr. Duresti with the Cranial Release Technique. I wanted to say, first of all, Merry Christmas, Happy Hanukkah, Happy Holidays to all our friends and family out there. Wishing you the best from sunny Florida. I received so many emails about what I've seen with cranial release, what can it do, what can it do, and of course, the simple answer is, in my opinion, everyone's better off receiving cranial release than not receiving cranial release. It's really as simple as that. You're better off having a fully functioning nervous system, regardless of whatever problem, diagnosis, issue that you're having or not having. So, to me, I look at cranial release like a way to optimize function, optimizing health. And a story does come to mind. It happened around this time of the year, many years ago, when I practiced in Flushing, Queens in New York City. And I had a gentleman that came in. He was the super of the building. I practiced in a very large apartment building. We had 300 apartments in the building. I was on the lobby level. And the superintendent of the building came in once, all bent over. He had injured his back lifting up floor tiles, which were very heavy. And I had known him casually. He was fairly a new recruit, a new employee to the building. And when doing the history, his name was Nick, and when going through the history, Nick said he suffered with insulin-dependent diabetes. He had rip-roaring low back pain that radiated into his left leg. As I got to know him, even from the first visit and every visit after that, he was a very, very high-strung man, very stressed about everything, about his job, about his family, about his hobbies. Everything that he did was just stress, stress, stress. Intensity would be a good word for Nick. In addition to that, I would say at the time he was about 48 years old and had the traditional male pattern baldness, no hair on the top of his head, hair on the side and the back. Nice man from Puerto Rico, about 48 years old, I want to say. When I looked at him from a cranial release standpoint, of course we know he hurt his back. Obviously his back is the reason why he came in. But when I looked at him, what I saw was his left eye. Now, I don't know, maybe in the camera that's different to you. His left eye, which on my skull is here, was obviously lower and more closed. You could see that the eye was smaller, more closed, lower. The cheekbone was lower. The ear was lower. And so in the world of cranial release, as the cranium, which should be doing this nice breathing mechanism, as we discussed before, the primary respiratory mechanism, when these bones shift and twist and rock, they sort of get stuck, for lack of a better word. And in Nick's case, it was more obviously contracted on this left side of his head. His whole left side was compressed. That is going to affect the covering of the brain and the spinal cord, which is called the dura mater. For those of you that went to Latin class, you know that means tough mother, the dura mater. So this dura mater, this tough covering, was now more contracted on Nick's left side, running down and affecting the entire left side of his body. So it didn't surprise me that he injured his back and the sciatic pain was down the left leg. Didn't surprise me at all. Also wasn't surprising to me that he was suffering from diabetes because the pancreas is on the left side of the body. So we started applying cranial release to Nick. And I would say in 2 to 3 weeks of seeing him a few times a week, I started noticing the top of his head was starting to grow his hair back. Some of you may not want to believe this. It's true. I've worked on a lot of patients that are bald, and that have stayed bald after cranial release. This gentleman, all his hair started to grow back. And after 2 or 3 weeks, when it was quite noticeable to me, I said to him, and he was feeling much better with his back and his leg. He was back to work. He lost a day or two from work because he was in so much pain, but now he was back to work. His diabetes had improved, he reported to me. His doctor had lowered his medication dose. But 2-3 weeks later, I noticed the hair starting to grow back on the top of his head. It looked kind of like peach fuzz. It was not the same quality of hair on the side of his head and the back of his head. And it was like sort of a peach fuzz. And I remember a few visits later, I said to him, Nick, what do you think about the hair growing back on your head? And he looked at me like I had 3 heads and said, what are you talking about? And I said, you're growing hair on the top of your head. And he just didn't acknowledge what I was saying. I said, come with me. We went into the bathroom. He looked in the mirror with another mirror and he almost passed out. He said, oh my God. He said, I've been bald for the last 5 years. And that started coming back. Now, do I know why? I could theorize. Under so much tension, so many stress chemicals, so much physical tension in his head. Now with the cranial release, relaxing everything, more blood flow up into the top of the head, to the skin, to the hair follicles, better nutrition up there from the cranial release, hair growth. When I left practice, when I left New York many years after that, he still, to my knowledge, had a full head of hair. And that's a story that I very rarely tell, but I've been getting so many emails. Please tell us a story about what you've seen with cranial release. So here's a story where a gentleman came in complete, and by the way, from an emotional standpoint, from a stress standpoint, from a daily stress standpoint, I got to know his wife, his family. The wife came in a few weeks later and said, I don't know what you're doing to my husband, but don't stop. He's a different person. He's more relaxed in the house. He doesn't fly off the handle like he used to. He's calmer. So that's one story of probably hundreds, if not thousands, that I have. I don't really tell those types of stories because, sometimes it happens, sometimes it doesn't. The point of the story is you're better off with cranial release than without. So, happy holidays to everyone. Again, if you're a practitioner and you'd like to learn more about the cranial release technique, you can visit the website cranialrelease.com. You can click the online training button, learn about how you can learn the cranial release technique from the comfort of your home or office. If you're a patient or you have a problem and you'd like to get evaluated, you can visit the website cranialrelease.com. There's a button, Find a Practitioner. Hopefully we have a practitioner in your area. And that's it for today. So happy holidays to all. Wishing you a fabulous holiday and New Year season. Talk to you soon. Dr. Duresti out for now. Adios, my friends. Be well. Thank you. Bye-bye.